Hi, Jill.
Hello, Allison. It's so great to see you. Thank you
Oh,
for inviting me to be here today. It's such an honor.
oh, it's so wonderful to have you. I'm so giddy because I've been longing to speak with you ever since, we worked together 6 years ago, but I've been following your journey and just loving everything that you do and put out there. And I'm really excited about our conversation today. So, everyone, I'll let Dr. Jill introduce herself. Who are you, Jill?
Hi. So first, just want to say I've been following your journey too, and all the growth you've done, and you blow me away. So it's such an honor to be here. And like I look at your Instagram pictures and I cry. So the beautiful pictures of you with new parents and bringing them through that process, and I see all the love and care and work in those pictures. So thank you. I am a licensed clinical psychologist. I specialize in perinatal mental health. I'm certified in perinatal mental health with Postpartum Support International. And I've been in private practice for on and off for 30 years now. Um, for a long time, I had a curriculum that I developed, and I did parent me classes for new moms. So that whole journey into motherhood, that first year, is like no other. So I spent many, many years doing that. And now I'm really more focused on private practice, working with um, parents and new moms, also a little bit of parenting work for, early childhood. So yeah, that's me kind of in a nutshell.
Oh,
I am a mom. I have a daughter who she's almost 29. I'm also a stepmom to wonderful bonus children, and I'm also a grandmother now. My oldest stepdaughter has two children of her own. So
oh, wow. Oh, so incredible. I can't believe it. The time really flies. And we know each other from working at this little boutique called the Pump Station, and that's really where I was introduced to becoming a doula, even all those years back then. And I just remember just always working there and filling up your classes. And if someone were to walk in with their new baby, it was like, let me see if Jill has availability in her classes because it was one of those you were incredible and such an inspiration and have been since. So I love what you do. And for the topic today, I was, curious what you want to dive into because I feel like we can talk forever about all these things, but the things that you were wanting to focus on really, excited me. So if you wanted to hop in.
yeah, I was thinking about a good topic being that you are a doula, and I work with new moms, and I was thinking maybe focusing on what we call like that fourth trimester, which is basically those first 12 weeks after you have a baby. Sometimes people really focus on it in terms of the baby. So they focus on, oh, that fourth trimester is when the baby is here in the world, no longer in utero, yet not yet ready to be their own little person. So it's sort of that symbiotic period where baby still feels like it's, connected to mom, baby and mom one, and parents in general, don't want to exclude dads here, really are helping baby regulate. And then after that fourth trimester, we say like babies kind of hatch, and they're a little bit more able, their circadian rhythm comes to be, their ability to start eating solids, like their ability to kind of move their bodies more, right? So they sort of are hatched and like in the world, whereas those first 12 weeks is sort of that transitional period. But I also really like to look at it as it's this huge transitional period for new parents, especially moms going through hormonal changes, sleep deprivation, recovery, delivery and pregnancy. There's so much going on that it's a period that really needs to be looked at and honored and talked about. because it's that process of becoming a mother, which is a whole new identity.
Hmm. Oh, wow. Yeah, so incredible. Just having followed so many, and as a birth doula, you're really only with them for the first 6 weeks postpartum. And even during that time, it's mind blowing what's actually going through them emotionally and how much more I was needed postpartum than in pregnancy. And the calls because I was still on call for all of these parents, and it was, yeah, people get into some really dark places, and we don't talk about postpartum enough and postpartum preparation. So how would you like explain those identity shifts, and how do those show up? Like, what are you, seeing?
Right, right. So, I mean, obviously it's going to be different for everybody, but I think that, we don't take into, how do I say this? We have to look at it really as this transitional period. And with any transition that you go through, there's always an element of loss involved, right? So when you think about any big move you made in your life, any big transition, I know you've made a bunch of big transitions, right? You're going to something, that you want, that's part of your journey that you're excited about. But you're also leaving behind something, and you're having to say goodbye, like just, going from high school to college, saying goodbye to all your friends and living at home and moving on and being on your own, or starting a new job, even if it's a job you want, you're saying goodbye to your old job and the coworkers there, moving to different countries, right? Like, so much of transition involves growth and beautiful things, but it also involves loss. And I think that's one of the things that people don't anticipate or don't have expectations of. And we want to really normalize, because you are saying goodbye to your old life, to the way you manage things, a lot of times to certain, you know, like time to yourself initially, and being able to sleep whenever you want. And a lot of times new moms will describe, I had this job and I felt really confident and competent in what I did. And I have this little baby, and like, I'm trying to read their cues and they're crying, and I'm trying to do everything and I don't know what they want. And I just feel so vulnerable and like I'm failing at this. And if we looked at it as we put more emphasis on, that's normal, right? This is, you're building a relationship with this little being, and you're going to need that period of time to figure it out and figure yourself out and figure out how to meet your needs and read their cues. This is all part of that transition. We might be kinder, we might be more self-compassionate. I mean, I think new moms in general, I'm not speaking for every new mom, but they tend to be so hard on themselves. They want to do this right, and it feels like, and certainly is, the most important job they're going to have. But that doesn't mean they have to be perfect at it. It doesn't mean doing it right means reading every cue, or baby never crying, or never feeling, like the best I can do today is just feed the baby and change their diaper, and I'm not going to make it to mommy and me class, or I'm not going to be able to put my makeup on today. Like, giving themselves that permission and that self-compassion during this time, because it is extraordinary. And it's also hard. It's hard on your body. It's, your hormones are changing, your body's healing from giving birth, your identity shift, who am I now? There's so many things that are changing in their lives. So I don't know, I kind of went a tangent and went off. You might have to edit that a little, but
Oh, that's incredible because how do you feel like it shows up in relationships and how that whole transition looks like? I mean, because there's so much, of course, going through the birthing person and the hormones and the feeding, and they're taking on the most in that sense of a role because that they are the ones that can. But yeah, everyone is super different. But how does that shift and change? Do you see the most?
Oh gosh, yeah. So, research states that relationships take a nosedive those first couple of years after a baby is born, because, you know, like you said, it's not just the birthing person that's going through all these shifts and changes. The partner's going through shifts and changes too. Levels of, like, how do we need each other? Things that used to come easily and naturally in your relationship, maybe like the amount of time we spend independently, the amount of time we spend together as a couple, you know, how we have our own interests yet come together. Like, a lot of times things like that just kind of settle in and happen organically. And now you have this baby, and I would hear a lot of like, well, my partner still gets to have their life. They're still going off to work and seeing friends or working out, or wanting to sleep in on the weekend, and I'm not getting to do any of that. So open communication is so important. Coming from I statements, because resentment can build easily. And then if you're feeling resentful, of their time, or them, still going to the gym or whatever it is, being able to say, like, I'm feeling this way, like, this is what I need, as opposed to you have it so easy. I do see a lot of partners starting to do like that tit for tat kind of thing. Well, I did A, B, C, D, and you walked by the sink and there are all these pump parts in it and you didn't clean anything, or like looking at what your partner's not doing.
Mm.
In reality, both partners are doing probably a lot, but we do know statistically that the reality is the mom or the parent that's being the one at home taking care of the baby does tend to do more at that time. I'm seeing that shift and change, but it's an easy build. Another thing I would say I see a lot is that parent's like day in, day out with the baby. So that parent is really bonding and like knowing the little cues, or the little like, oh, if they do this, we're past nap time. If they do this, they need a different environment. And the parent that maybe has gone back to work or isn't, able to do as much hands-on, isn't seeing those cues as easily. But then comes time where that parent is home, and the parent that's the one home hands the baby off and wants a break, and the baby starts to cry. And the parent that doesn't have the baby as often sometimes is, look, let me deal with it. Other times is, you know what to do, or they must need to nurse, and is quick to hand the baby back. Or the parent that hears the baby crying is now getting anxious, and all their hormones are stirring, and they want to stop that crying no matter what. And so they take the baby back. And this just perpetuates that cycle. It perpetuates the cycle of the parent being home with the baby, rescuing or taking back the baby, and then the baby not bonding as quickly, and not developing the confidence in the other parent. So that's one of the dynamics I see, and we usually would talk about it. I talk about it with my patients. We talk about it in Mommy Means. You have to let that relationship build. You have to let that bond develop, and sometimes that means putting on earphones and putting music in, or going for a walk, or just trusting that your partner is going to figure it out, and the baby might cry a little bit longer, but they're in the hands of someone you trust and in the hands of their other parent. So we need to trust it will be okay, and actually really benefit the other partner's ability to build their confidence.
Mm. Yeah, that's incredible. It really is, because I mean, being pregnant now and going into that and not knowing as much postpartum. I mean, I know about those first 6 weeks, and then I'm like, and then what? Because it really is like I have no idea. It's like that's kind of where my specialty ends, and where I also feel like with my partner as well, how it's all going to be for him, and how we can already start mentally preparing, like, what are your needs and what are my needs, and what do I need daily, 15 minutes, 30 minutes a day to take care of me, and what does he need just to stay mentally stable. And I think that comes with maybe us moving a bunch of times and knowing that we've gone through a lot of really hard stuff and transitions, but nothing quite like this. And it all feels, of course, feeling nervous, feeling excited, feeling all those things, but also feeling like our relationship is about to change on a really deep level, and not knowing what that's going to look like is, yeah.
Right. So just in hearing this, hopefully, like, I mean, I know, you do experience the first 6 weeks, which is huge. But does anything come up for you, like in what I just said, of, oh, that's something I want to be aware of, or that's something that now, like, I'm going to give myself, hopefully, like, I'm going to give myself more permission, to figure this out, or give myself that self-compassion. One of the tools when I'm working with someone in my private practice is we talk about sort of the 4-step process of self-compassion, which sort of evolved from Kristen Neff's work. She's amazing. She's done all this research on self-compassion, not necessarily for new moms, but it applies really well. And so the first step is, like, taking that breath. And if you're in a moment where the baby's not latching, or they're overtired, and no matter what you're doing, they're crying, a lot of times we so focus outward onto baby and what's not going right. And if we could kind of turn inward for a moment, and the first step is just to kind of take that breath and go, this is a hard moment right now. Like, what I'm experiencing is tough. I feel like I acknowledge that and give myself permission to feel that. So, and then the second step, so that acknowledgement, and then that second step is the human experience of it, which is so important. I'm not alone in this. Like, all new parents go through this. I am not, because we tend to do that. I'm the only one. And then we go to a Parent and Me class, or we speak to other new moms, and, they look freshly made up and they're smiling, and we're like, they have it all right. They know exactly what to do. I'm the only one who's, struggling here. And sometimes that even keeps us from discussing our struggle, because we feel isolated and alone in it, where if we open up, we'll start hearing, oh gosh, me too, or I feel you, or yes. And that's what made those Parent and Me classes so valuable, was moms just being able to leave their ego at the door and really share the struggle and see they're not alone. But if you're doing that process of self-compassion, just to remind yourself, I'm a human being having a human experience. All new parents feel insecure. All new parents are going to have hard moments. I'm not alone in this. And then the third step is, what would you say to a friend? What would you say to someone you loved, right? So, a lot of times we speak to ourselves so much more critically with so much more judgment than we would ever think to give to someone else, especially someone we love and care about. So, moms will say to themselves, like, why aren't I figuring this out? I'm a bad mom. I don't know what I'm doing. You know, I didn't think it would be this hard. I'm failing at this, but to another mom or to another, person they love, they would authentically, genuinely say, you're doing amazing and this is hard. And, take a breath, and maybe you need just a little break. And what do you need for you? And you're forming this beautiful bond. And there are going to be tough moments. It doesn't mean you're failing at all. And we would talk like that naturally and believe every word, but we don't do that for ourselves. So taking that moment and thinking, well, what would I say to somebody I love, or that is going through this, that I care about? And however you would respond to that person is how you need to be talking to yourself. And then the last step that I like is I like to put your hand on your heart, just really kind of center inward and say an affirmation. Affirmations need to be in the present tense. They need to be what you're aspiring to be, but they can't be like a fantasy or you won't believe it. Like your brain will go, well, that's not true. So if you don't feel like you're being the most amazing, perfect mom in the moment, to say, I'm the most amazing, perfect mom, you're not going to buy it. But you could say something like, I'm doing the best I can. I'm giving my baby what he or she needs. I'm learning every day. So something like that, where you can see the truth in it, but it's helping to reframe and change your perspective.
Hmm. Oh, that's an incredible tool. Thank you for sharing that. It's really, I can see that being incredibly helpful postpartum, especially because there is a lot of that just reassurance. And yes, you can do this. And yes, every parent is going to do things differently. And there is no right or wrong way to do this. And like, I think listening to that intuition too, and yeah, seeing the guidelines, and you're following all the things that people maybe are talking about, but also daring to experiment, and also going and listening to the baby also more of what are they telling us, and again, just trying to follow that intuition of like, okay, so how am I doing? If I'm not able to really connect right now, this is time for me time, and my husband can take over, or whatever that looks like, if I'm starting to feel not compassionate towards myself anymore. But yeah, I've experienced so many parents that go through that, and it's really, really hard to just witness it all. But also what an incredible tool. So thank you for that.
But I
So
mean, you just described yourself, like a lot of that experience that we hear about, and one of the things is to always check in with expectations. And one of the things that would come up again when I was doing these classes, and definitely comes up in my private practice, but more so when you could kind of throw it out to a group and ask the question, is like, what is different than what you expected? What at this moment in time is different than what you expected? And I will share, do you know what can you guess what the two main things are that we hear about?
oh, maybe something with sleep and something with feeding.
Exactly. It's feeding and sleeping. And I would say those are the two areas that I think, again, I can't speak for everyone, but in general, I'm working with so many moms over the years that bring about the most anxiety, and the most judgment. Sleep, understandably, is so important, because when we're not getting enough sleep, our moods are going to fluctuate more. Anxiety and depression is exacerbated. Sometimes it's the entire cause of postpartum depression and anxiety is sleep deprivation. Other times there are a lot of other things that play into it, but when a mom starts getting adequate sleep, their ability to manage and handle things improves tremendously. So sleep really is important, but if our expectation gets hyper focused on how do we get the baby to stretch out sleep and how fast can we get them to stretch out sleep and what am I doing wrong that they're not getting, that so-and-so's baby slept 5 hours stretch and mine didn't, that's not going to be helpful. Okay, babies naturally, the way that they are, especially in that fourth trimester, is they do wake often. They don't do big long stretches. They do need to feed often. So the focus needs to be more on how do I arrange this with my partner, or how do I bring in the community, so that I can get at least, we know research shows at least 1 4-hour chunk of uninterrupted sleep. And at the very beginning, it's very challenging because if you're exclusively nursing, your baby won't be able to go a 4-hour stretch. And we usually say, not to pump immediately, give it a little bit of time so that baby learns to latch. So it is challenging, but even something like if it's that 4-hour stretch of which mom is supposed to get uninterrupted sleep, if baby wakes up, maybe if partner or postpartum doula or night nurse can come in and bring baby to mom so that she doesn't have to really fully wake up, bring her to the breast as soon as baby's done. That person is the one to burp them, change their diaper, settle them back in, so that even though the mom's doing that nursing session, they're getting as close to that 4-hour stretch as possible. That can be huge, but we tend to hyper focus on getting the baby stretch, because we're so concerned about the baby's needs and that the baby will be, the baby won't thrive, the baby's brain development, the baby will be, right? And it's like babies are going to have disrupted sleep at the beginning. Their biology isn't regulated yet. Their circadian rhythm isn't regulated yet. So babies usually will be fine, and if they do get overtired, they manage it. They are overtired. Yes, of course it's frustrating. Yes, of course we don't want to see our baby crying, but we're holding that baby. We're showing that baby love and compassion. That baby doesn't feel alone. It's just overstimulated. It will eventually go to sleep. Babies will be fine, but it's the parents that if they're chronically sleep deprived and not looking at that self-care, can create, a lot of depression, illness, memory issues, right? So sleep is important, but it's usually we need to focus more on our sleep. And then feeding. A lot of times people will assume that, well, I'm going to be breastfeeding. Breastfeeding is a natural thing, so it will happen naturally. And breastfeeding is very much, as you know, a learned skill. Breastfeeding oftentimes takes a lot of time. There can be unanticipated struggles and issues. And again, parents will have so much anxiety and blame themselves and have so much self-judgment if it's not going easily and smoothly. And so if we can look at it as, the reality, once, you get past that hump, a lot of times parents will find, oh, it's really easy. I have my boobs wherever I go. And yes, I don't have to think about heating bottles. But initially, there's so much involved with it. And again, that self-criticism, that judgment, if it's not going smoothly, causes tremendous anxiety.
Yeah, I can agree so much because that's what I really see those first 6 weeks is it's sleep. They're texting me in the middle of the night with sleep or feeding things that are happening. And it really is when I would do postpartum visits, it's like, how have you been sleeping? And like, oh, I haven't slept since the birth. And I'd be like, red flags, red flags, red flags, all going off because not only that, they would be having really scary thoughts. They like transitioned into this person that I'd never really even met before and were having some really scary thoughts. I was proud of them for telling me, what was going on for their minds, but it was also just witnessing where the mind can go when your own sleep is not taken care of. And it's something that I've been with my husband of like, and my mom is going to be helping luckily, but that's a whole nother thing that I'm worried about. But it really is like, I need to be getting my 4 hours. And I think being a doula and being on call for three.
And just to interrupt that, it's not only 4 hours, it's a 4 hour chunk, right? We need 4 hours uninterrupted. But then hopefully we can get more, but it might be interrupted with feedings, etc. But we want that uninterrupted 4 hour chunk.
Yes, and 8 hours ideally throughout a 24-hour period. But it really is because it's going to be hard in the beginning, but I feel like being a doula and being on call for 3 years has trained me amazingly for that period because I would be awake for days and yeah, an hour here, an hour there, and that was really hard. But it just shows you how resilient we can be, but it's not a good thing either. It's not sustainable after you can't do that forever. So now and then maybe, but you have to have help.
And you brought up something so important I want to go back to is you said how a lot of new parents can have intrusive thoughts. And so just want to really normalize that as well. There are studies that say up to 50% of new parents will have intrusive thoughts. And it is a sign of anxiety, the intrusive thoughts, but it scares us because they're disturbing. Oftentimes it can be, oh my gosh, I'm having this image of dropping my baby down the stairs. I'm having this image of just forgetting to feed my baby or leaving my baby someplace. So I always just like to emphasize that, yes, of course, if you're having intrusive thoughts, to talk to someone, maybe even go to therapy, but to know that if they're what we call ego dystonic thoughts, so they're upsetting to you, like it's like, I can't believe I had this thought, like I would never want to do that. If that's the case, which is the case, which is most likely the case, with the exception of postpartum psychosis, which is a real thing, but much rarer. But if it's postpartum psychosis, the thoughts are what we call ego syntonic, meaning the person feels like, well, this is for the better good, or there's like a voice telling me to do this that I need to listen to, right? So it becomes more of a delusional thought. If it's an ego dystonic thought, which is, why am I having these thoughts? These are really bothersome. I don't like them. To know that it is in no way indicative of you actually hurting or harming your baby or doing something, that feels like that's out of character for you, that you wouldn't do. So if that thought comes in, I think part of what makes it so scary is parents worry, am I going to do this? I'm thinking it. Am I somehow going to do it? And there's no relation between the thought and the actual behavior.
Mm.
And that's important to know. And sometimes just knowing that, helps them subside a little, because if we are trying to push the thought away, it will come up more. It's like if I say to you, don't think of a pink elephant, don't think of a pink elephant. What are you thinking of right now, right? So if I'm like, don't have that thought, don't have that's a bad thought, don't have it, it actually makes that thought more prominent. So if we could go, oh, there's that thought. I've had that thought before. It's probably here because it's just trying so hard to warn me to, be the good parent, to be on top of things. it's in some weird way trying to protect me to not do something horrible, right? And if I say, okay, there you are, I hear you, I understand why you're here, but I'm going to ground myself in the present moment. Right now, everything's okay. I'm fine, and thank you for sharing. But I'll take over from here. A lot of times when we can practice things like that, that's like one of the tools is just acknowledging it, but seeing it as a thought. I'm noticing I'm having the thought that, right? So if I just go, I'm thinking this bad thing I'm going to do, now it's all me. But if I go, I'm noticing I'm having the thought that I might drop the baby down the stairs. As soon as I go like, I might drop the baby down the stairs too, I'm noticing I'm having the thought that I might drop the baby down the stairs. We already created a little bit of distance between ourselves and the thought.
Mm.
Does that make sense?
I love it. I love it. Do you ever recommend like journaling the thoughts or and then like burning them or just like putting them somewhere? Or is that not helpful?
Yeah, no, journaling is hugely helpful. How I would suggest doing it is like a two-parter. So first you just write out whatever the thoughts are, whatever you're feeling, or just even if it's not intrusive thoughts. Let's say it's just, this is more than I expected. I'm worried I'm going to be able to do this. I was a bad mom today because the baby was crying while I was in the car and I couldn't do anything about it. And my baby cried for 20 minutes. And what parent has their baby cry for? I should have known, right? Like all these things, the way we talk to ourselves, if we can get it all out on paper, and then we can take a pause. And then I ask you to actually come back to the paper and write a response from your divine self, or from like your inner knowing, or from even like love, universal love. I don't know if anyone's familiar with Elizabeth Gilbert, the author. Which is this wonderful Substack called Letters to Love. And every week she has people write letters that are from love, right? And love can be like your higher power, it could be the universe, it could just be the part in you that is pure and full of love, like however you want to see it. But she has people say like, love, what would you have me know today? It's a beautiful, if anyone ever, I'm not getting paid for this. She's amazing. It's a wonderful Substack, Letters from Love or Letters to Love. But that idea of going, like reading what you wrote and then going back and answering it from love, right? So, and in a way, it's a little bit similar to what would I say to a friend or to someone I love, right? So if a love was looking at what I just wrote, how would love respond, right? How would that part of me respond? And that can be really healing because it's just, you just let whatever comes out, come out. Like you don't overthink it. You just let it go. And a lot of times you can see when you do that, you can see the part that was having so much judgment and so much criticism as a part. This isn't all of me. This is a part of me. And that part of me that has so much judgment and criticism is actually trying to protect me, but is doing so in a way that's not really helpful, right? It's trying to be like, you messed up here, you messed up there. Why did you do this? Right? It's trying to protect me by going, if I scare you, you won't mess up, right? If I am so critical, I'll drive you to be perfect, right? It's actually trying to keep you from your vulnerability. But in reality, that part is making us feel more vulnerable and not worthy and not enough. So if we write it out and then we have that response from that part of us that is attuned to that inner knowing and that kindness and compassion, we can then switch our perspective. It makes it a lot easier.
Oh, I love that so much. That's such good advice. Do you ever like in your classes of Mommy and Me, or even now, think that in the postpartum period, how people are doing is because of how they maybe gave birth, like if it was a traumatic birth, if it was a positive birth. What do you see in terms of that? Just because it's, it's something where even, yeah, I've seen a range of births and hundreds of them, but yeah, I'm just curious how that shows up in maybe a community setting or a group setting, or if you can see, oh, that person, yeah, I'm not sure if people share a lot about that, but
Yeah, that's something I would probably say absolutely can come up in a group setting, but I think that's something I see a lot more when I'm working one-on-one with somebody because it's so vulnerable. So like in a group setting, I might hear like where a mom kind of says, well, I had an unexpected C-section that was really hard. And they'll share a little bit, which is beautiful and wonderful, but to sometimes to really peel back the trauma of your birth story is something that I would recommend, having a professional to do that with, because yes, absolutely, that can that is a form of postpartum depression that we call postpartum PTSD. It's a trauma. If you have a traumatic birth, your body is storing that trauma, and if you don't have a way to process it, it can affect. It certainly can cause postpartum depression and anxiety. It can cause difficulty in bonding with the baby. It can really kind of take over that fourth trimester. And so looking at it as, again, a lot of times there's an expectation, it's going to go one way and it went another. You can feel robbed of that experience. You can feel like you failed at giving birth. I know, and I say that probably, hopefully people listening are going to go, how can a mom feel that way? But people do, like my body failed me. I should have been able to do it this way. Most women can. Like, what's the matter with me? Like, we listen to this and we go, oh my gosh, like, please, this is not your fault. But when it's happening to you, a lot of times those thoughts and feelings come up. And so being able to process that and release that, it can tremendously impact somebody. And when we talk about trauma too, I always like to say, because sometimes people are like, well, yeah, it didn't go the way I wanted, but like, I'm fine, my baby's fine. So, and that's the message they kind of get from the outside. Like, yeah, but in the end, everybody's okay. So we're good, right? And it's trauma is anything that your mind is having trouble processing that then goes to your body, that your body's not able to process because your mind is having a hard time understanding and processing it. And that mind body connection, and then how it appears in your body in forms of illness or anxiety or disabilities that come up, right? There's so much. So we first have to reframe even trauma, because, people will say, well, but thankfully in the end, I'm okay, baby's okay, right? It doesn't mean it wasn't a traumatic experience. And so if we try to brush it under the rug saying, well, but we're all okay now, we're not honoring what we went through and processing it the way we need to.
Such an important point. I always tell clients, like, as soon as you feel ready, I want you to write the whole birth down sooner rather than later. I just want you to just write out what you remember and have the partner write out what they remember, because you forget so many of the details, and it can help with processing it later, like with a professional, if things came up. Not all clients do it, I know, but it's one of the things that I have felt or have learned in different settings, that just writing it down and putting it on paper, at least, of the timeline or whatever came up or thoughts or however, and then revisiting that after 6 months, after a year, you'll remember different things. And just because it is it's a traumatic event for the body, no matter what, if it was a positive experience or not so positive, it still lives in you for the
Right.
rest of your
And even like you said, even just writing it down is therapeutic in of itself. In a group setting, it's a little trickier, right? Because like one of the things I would never do, I know some instructors did this and had success with it, but one of the things I would never do is I would never go around, especially like the first couple of weeks of class, and go, tell us your birth story, right? People would do it as a way to just kind of bond, like, oh, let's share our birth stories. But you never know what somebody's birth story was. And if somebody really did have a traumatic birth story, even just trying to talk about it, it can re-traumatize them. So it's something we really have to take mindfully, as friends, as family, as like, oh, tell me about your birth story, right? Like it needs to be something where the setting is right and the person feels comfortable and the person, like you said, feels ready. So I love your suggestion, like write it down, because that's between that person and themselves. But it's also a way to start processing it. And in writing it down, they might see some of the feelings that come up that they then might say, wow, I've been holding a lot in, like I do need to speak to a professional, or I do want to talk to my partner about it. And that will help in that process. So not ignoring it, but also not being pushed into sharing a story before you've had a moment to process it yourself, like in a casual setting. Like, what's your birth story? But I do agree too, the opposite is I have seen examples, which is lovely and beautiful, of people who have these wonderful birth stories and feel very empowered and feel, look at what my body did and look what I created, and like, wow, like this whole new appreciation for what they can handle and what they can, bear. And that does, in the, on the bright side, that can create going into motherhood with a lot of confidence. So yes, there are some beautiful, lovely birth stories, but your birth story does not define how you are as a mother. And, if you had a great birth story and you feel confident, wonderful, terrific. But if you didn't, it does not mean you cannot become a confident, loving mom. It doesn't define your role as.
Oh, so beautiful. So beautiful. No, I love it. Well, yeah, I mean, like I said, I don't know where else we can go from here in this conversation.
We could talk forever, but
Forever.
you probably don't want to have a 5-hour podcast, right?
I mean, I could have you on so many more times. But I do have a few questions, unless there was something else that you were wanting to talk about in so far.
No, I'm totally open. Just whatever you wanted to. My agenda was, well, whatever Alison wants to talk about. I'm happy to try to contribute what I can.
Okay, so what is one myth about postpartum that you wish would disappear? Can you think of any?
Oh, yeah. I mean, so many. But I think that, yeah, that it's just going to be this joyous, magical time. I always bring up the idea. I love the poem by Walt Whitman. I can't recite the whole poem, but there's a line in the poem that is, do I contradict myself? Yes, maybe I do. I contain multitudes. And it's to go into it as, yes, there hopefully will be moments of bliss and joy, and look what we created, and look at this being, and oh my gosh, I could stare at them sleeping, and this is magical. But right alongside that, can be some trying moments of, am I doing this right? What did I get myself into? Am I ever going to sleep again? Who am I now? My whole identity shift. And those two things can both exist at the same time. They're both genuine. You're not fooling yourself, or being a bad mom, if you don't embrace all the parts. And so I think that would be that myth is, it's just going to be this. I've been wanting to be a mom my whole life. This is just going to be this blissful, lovely time.
Mm.
I guess that would be, and then the other one is like what we already touched upon that I would hear a lot is like, nobody told me breastfeeding would be so challenging. Um, that there's this myth that because it's natural, it will happen naturally and easily. And that's a huge myth. So that would probably be the second one.
Mm.
Oh, and I'll add a third. We'll feel so much closer as a family. Like my partner and I will just feel so much more bonded to one another because now we've created this being together, or we're raising this being together. It's our being, right? And again, there's moments of that, like, oh my gosh, like we have this baby together, like the commitment. But there's also, with anxiety, depression, vulnerability comes polarization. And a lot of times it is a time in our partnership where we polarize. And so being aware of that, mindful of that.
Mm.
Not
So
to scare you, because
but
having that information, because I know Allison's going to be a new mom very soon. Having that information is like, well, okay, this can happen. Like if we start, like one thing I would hear a lot in classes, I love my partner, but I can't stand them right now. Like I still really love them, but I hate looking at them right now, right? Like because they're irritating me, right? So knowing that and then hearing, oh, that's normal. That's what can be like, okay, that doesn't mean we're not going to be okay. That doesn't mean we're not going to get through this, but it does mean we need to communicate more. We need to sit down more. We need to sit down, not in a moment of anger, in a moment of calmness. And we need to use a lot of I statements, not like, this is what you're doing wrong. Like it's more of, this is what I'm experiencing. This is how I feel. But that's, that relationship is going to have to be renegotiated a little bit. I haven't run across a relationship yet that hasn't needed some renegotiating. So that idea, like it's just going to bring us closer together. Yeah.
Oh, yeah. It's such important myths because, yeah, I mean, you could never scare me. I love this field and I love learning from so many incredible professionals like you. And I feel like I've just seen a lot of, being already have been with them during pregnancy and then birth and then coming to postpartum visit and just seeing the tension and just seeing that, okay, maybe I need to talk to the partner alone and just like see what's going on for them and then talk to the birthing person alone and kind of see what's going on for them, because I would witness some things. And I love that you say that too, about there's going to be some renegotiation that's going to need to
And
happen.
what you just said speaks such volumes because, you know, a birth doula, like, and I know you do a lot of births, home births, right? But even like it speaks to the importance of having a birth doula, like even if you're having your baby in a hospital with a doctor, because just what you said, that ability to have that person with all that knowledge and of course if it's you, kindness and just such a big heart. But I'm sure a lot of birth doulas are like that as well, but having that person who can see that and who can pull aside, the partner and be able to, this is a lot for them too. And if they see their partner struggling or in pain, they might not know how to handle that. They might not be thinking clearly where normally they would be like, I know what I'm going to ask for. I know how to advocate for my partner. But in that anxious state or being overwhelmed, they just can't. And so having that birth doula who can then be the advocate, who can be there for both partners, it's such a huge difference. And people sometimes underestimate that because, they're saying, well, we're going to have a doctor, so we don't need the birth doula. But to think about that, because it can play a really vital role.
Oh yeah. I mean, most of my clients have definitely given birth in the hospital and not one of them has said like, oh, we regret having a doula or anything, because it was really like you're in a different role than I'm not. I don't have to care about the medical stuff. I'm there for you emotionally and physically, and I really care about your experience and wanting it to be as positive as possible no matter what happens, what comes up. But yeah, I feel like it's a lot of the partners too that sometimes need me more, especially postpartum.
Yes, I think it's such an unfair thing we put on partners, right? Well, they're not going through the delivery, so they'll be fine. It's like this is the person they love. They're seeing them in pain. If something isn't going as we expected, there's a lot of emotions and feelings that they're experiencing too that are valid and that need to be acknowledged and that they might need some support with.
Mhm.
Yeah.
Absolutely. Absolutely. No, I've loved my time as a doula, even though I'm not practicing right now. It's just like it's taught me so much about just the humanness, and just realness of this experience and all that it can bring. And to not have any expectations is a big one. Is there any one book or tool? I mean, we went through the compassion tools, which I loved, but any book that you find yourself kind of recommending to people or anything like that?
Oh gosh. Oh.
Just one book, no.
I mean, I think when it's for books, like what comes to mind is a lot more parenting books that are popping into my head. But I know Alexandra Sachs um, has a book that's really great, and I'm blanking on the name, but the author is Alexandra Sachs, and it's a book on becoming a mom and that process. So I don't have the title for you, but if you look her up, Alexandra Sachs, MD, it is a book that talks a lot about that fourth trimester time and gives some really good information. There's also this book that I don't even know if it's in print anymore, but it was called Buddhism for Mothers,
Ooh.
that I used to love. It's an oldie, but it talked a lot about like some of the basic principles of Buddhism, but a lot of them were really mindfulness practices, and going through that period with a lot of the tools we just talked about, with taking breaths and grounding yourself and asking what you need and sort of like that checking in, and taking that self-care, and we talk about self-care, that comes up sort of as a buzzword, and sometimes people think of it as, oh, I took some time to go get my nails done, or I got a massage. And while I have nothing against a mama getting their nails done or getting a massage, of course, it's not like treating yourself. It's really like that inner work of, am I taking care of myself? How am I treating myself? Am I eating right? There's this little acronym, so this might be a nice thing from Karen Kleinman, who's done a lot of written a lot of books on postpartum depression and anxiety, and she has this little acronym that's SELF, the word SELF, and it stands for sleep, exercise, laughter, and food. So it's just a very quick way to go, how's my sleep? Am I getting any movement? Am I getting outside? Am I moving my body? Am I laughing, right? Which can be like, am I spending time with friends, or am I doing something I enjoy? And am I feeding myself? Am I eating, good nutritious foods? Am I drinking enough water? Those kind of things. And so that's what I'm talking about with self-care, right?
Oh, beautiful. Oh, no, that is incredible. And yeah, the last question that I really had was, is there a moment, professional or personal, that changed how you view early parenthood forever?
Oh gosh, just a little question to
Just
end.
like small
Uh,
deep questions that I didn't even send you beforehand.
and none of these questions are sent beforehand. I don't know the author. I don't know the name of that book. I know the author.
You're
that changed my perspective. Yeah, I would say that would probably be mostly from my own journey as being a mom, and how much of a spiritual journey being a mother is, how you go through and revisit a lot of your childhood wounds, your attachment issues, um, your ability to put somebody else first, your ability to tap into unconditional love. Um, if you ask me the biggest blessing of my life, I will always quickly and easily tell you it's my daughter. She has just taught me how to be the human being I want to be. So, and that's not to say like every moment's been beautiful and lovely. You know, when she was a teenager, I would call up my best friend and we would be like, oh, what did yours do today? And I'm sure I had moments like that when she was a toddler and testing boundaries, but just seeing how you think about everything differently when you're a parent. It's not always about, you know, how does this affect me? It's what am I modeling? What lesson do I want to give here? What do I want to teach in this moment? Am I really tapping into my values in these parenting choices, right? Because I read this book that said this, and my parents said I should do it this way, and my friends said I should do it this way. And what next step really aligns with what my values are, and what are my values? And I really have to become clear on that, right? So that experience, best experience of my life.
Hmm. Oh, thank you so much. That's beautiful. I just feel like I have so much to look forward to, and I'm so grateful for you and your time and the work that you do for new parents all around the world. And yeah, you've impacted so many humans, and I just am so grateful to have you in my life, even in a small way, but that we can still follow each other's journeys and everything. And I'm just, yeah, very grateful for your time today, Jill.
Thank you so much. It was so special seeing you and catching up. It's been a number of years, but you've always, I mean, you are 100% one of the people that when I think of, I smile immediately. So thank you for your friendship, and this has been a pleasure. And I'm around once the little one's born. I know we're in different countries right now, but you can always contact me.
I will be leaning on you for sure. Thank you so much.
Okay, take care. Thank you. Thank you for having me. It's been a pleasure.